Hey there, nursing students. Welcome to your Week 1 High Yield Explainer. We designed this specifically to prep you for your very first quiz in Dr. Q Kindle's NSG 331 Healthy Aging course. So, if you're looking for a direct, focused review of the absolute most testable concepts from this week's material, well, you're in exactly the right place. Let's dive in. Here is our quick roadmap for today's review. We're going to hit course logistics, the gerontological nursing imperative, defining health and wellness, population trends and demographics, and finally, addressing ageism in care. All right, starting us off with Section 1, Course Logistics. Okay, let's take a quick look at how you're actually being graded in this class. Notice that your weekly quizzes make up a massive 50% of your overall grade, literally half your grade. And that is exactly why this explainer review session is just absolutely crucial for your success. You also want to keep the Healthy People 2030 assignment on your radar. It's worth 40%, and it involves a pretty lengthy report and presentation. But right now, let's just focus on securing those immediate quiz points. Moving right along to Section 2, the Gerontological Nursing Imperative. Before we get completely bogged down in all the hard medical definitions, I think this quote brilliantly illustrates our core mission. Maya Angelou reminds us that gerontological nursing isn't just about, treating physical ailments. Fundamentally, it's about holistically addressing the bio-psychosocial needs of older adults. It is a wellness emphasis. We are moving away from just caring for the ill elderly and moving toward truly optimizing their overall quality of life. Okay, circle this, highlight it, whatever you got to do for your quiz. You absolutely must remember this contrast. It's a foundational concept. Senescence is just a normal physical aging change. It happens to literally all living things. Senility, on the other hand, refers to abnormal cognitive decline. Hear me on this. Senility is not a normal part of aging. Keeping this distinction crystal clear is key to accurately assessing your future patients. Let's do a little active recall straight from Dr. Quakendall's lecture material, all right? If you see a question asking about predictive trends for older adult healthcare, you want to zero in on this exact answer. We urgently need more nurses with specialized knowledge in older adult care. The demand for targeted, competent clinical judgment in this specific area is just skyrocketing right now. All right, on to Section 3, Defining Health and Wellness. So here's the absolute crucial point. The holistic health movement completely reframes how we look at things. When we talk about healthy aging, it's really not just about curing a disease, which, let's be honest, often isn't even possible with chronic conditions anyway. Instead, it is all about optimizing a patient's resilience, tapping into their resources, and maximizing their functional ability. We want them to hit their potential for optimal health, whatever that looks like for them personally. Now, think about this next quiz question super carefully, because honestly, it trips a lot of students up. Can a terminally ill patient still achieve wellness? According to the nursing framework we're studying, yes. Yes, they can. The key takeaway here is that the patient always retains the right to define what wellness means for themselves, regardless of a terminal diagnosis like end-stage cancer. It is absolutely not up to the healthcare professional to define it for them. Another major concept you'll want to review is the difference between chronologic and biologic age. Chronologic age is just the calendar, right? Grouping people into the young old at 65 to 75 or the elite old at over 100. But biologic age, that is what really matters clinically. Remember that biologic age is shaped heavily by lifestyle factors, things like nutrition, living conditions, disease control, and health technology. Okay, Section 4, Population Trends and Demographics. Guys, this data is just absolutely staggering. By the year 2050, the global population aged 65 and over will actually exceed 1.5 billion people. That's right, billion with a B. That is going to be 22% of the entire world's population. To kind of put that into perspective for you, in 2020, the number of people at least 60 years old officially outnumbered children under 5. The face of healthcare is changing so rapidly. And if we zoom in on the US specifically, diversity is exploding in our older populations. By 2060, people of color will make up nearly half, 47% of the US population aged 65 and older. This means your cultural competence as a nurse and how well you understand the different ways ethnic groups experience healthcare is going to be more critical than ever before in history. Here's a pro tip for another potential test question you'll want to lock in. When you're asked about the sheer massive volume of older adults worldwide, look for the options that tie this population explosion back to two main factors: extending lifespans, which we can thank better sanitation, antibiotics, and disease control for, and just a general overall aging demographic.
And finally, Section 5, Addressing Ageism in Care.
You definitely want to commit this exact definition to memory for the quiz. Ageism is a prejudgment or stereotyping based solely on someone's age. And listen, this isn't just some harmless generalization. It can dangerously skew a healthcare professional's perception. It leads to undertreating or completely dismissing a patient's totally valid concerns just because, quote unquote, they're old.
Now, you've got to contrast ageism with gerontophobia. While ageism is a prejudgment, gerontophobia is exactly what it sounds like. It's a real phobia. It specifically involves an abnormal, deeply rooted fear of being around elderly people. Or, and this is interesting, even an abnormal fear of the aging process itself and getting old.
So, as we wrap up this explainer for your Week 1 quiz, I want to leave you with a provocative thought that moves beyond just passing an exam and into your actual future clinical practice. How will you personally use therapeutic communication to overcome hidden biases like ageism to truly understand your patient's own definition of wellness and to empower them to achieve their highest level of health? Keep that mission in the back of your mind as you head into your exam. Best of luck on the quiz and keep sharpening that clinical judgment.